Do you think there is, from your perspective, a good thing that comes from mental health diagnosis that give people some sort of relief around that? Because I know that I've heard that of like having a solution and something like presented in front of you that you're like, oh, okay, it's not just in my head. Like this is what it is. What is your perspective on that side of it?
I've heard some people say, we've worked so hard to reverse the stigma, and now you're just saying none of this is real. Like we're fighting for people to understand this is an illness. And I get that perspective. And I think for some people, it gives them a sense of relief, like, wow, there's something bigger at play here that I don't understand. And it's not my fault, right? And I think that's healthy, right? We don't want to tell anybody it's your fault what you're feeling, but we want to also not lose that it's your ownership. It's within your agency to control a lot of this. And it's not 100% out of your control, because that doesn't feel empowering. And then what are we really doing in a mental health industry, right? Because if it was that simple, 100% genetic, then we would have a medication that fits that. We would have CRISPR coming in and saying CRISPR is solving ADHD. Like that's not happening in the near future. And so we need to broaden our horizons while maintaining a sense of empathy for self and not feeling like, oh, I just need to tough it out, right? Because that's the narrative that we were getting away from over the last few decades. I don't want to get back to that narrative, like just tough it out. No, that's not it either. Just learn to love yourself, explore yourself, understand why you show up certain ways in certain circumstances. And most importantly, that the way you show up is not static, right? We're not just this binary version. We're either this way or that way. There's so much in between. We're dynamic. We're always changing. Our circumstances, our life situation, all of that can propel us. And I think if we stick too stringently to diagnostic criteria, we're giving people a life sentence. And it's not that, right? This is not a disability. It's more like a cast when you're getting mental health treatment. You just need your emotions need a little support, just like a broken bone needs support. But then we look to take the cast off. And for some people, they need longer rehabilitation, and that's okay too. But for most situations outside of like schizophrenia and severe bipolar mania and some other things, this is not a life sentence. We're approaching mental health, I hope, from a more loving place when we see it less as a rigid diagnostic criteria.